My name is Cindy Hoffman, and I've been doing the treatments for approximately 4.5 years. My journey began when I had a transplant back in December 2017, and my kidneys went into failure 10 days after I had my transplant due to the overwhelming new liver hurt them, and also the anti-rejection medications. So I went into complete failure, and they fixed it real fast. Within 2 days, I was fixed again, and I didn't have any kidney problems before that. But they started dropping down about 6 years ago, approximately. And I went into complete kidney failure again. I had to be in Trail where they helped me stay alive. I was there for 3 months, and my husband had to travel from Cranbrook all the way to Trail and back all the time. And he actually missed a whole bunch of work because of it. It's really detrimental on the funds when you don't have something right here in Cranbrook that we could have been staying here, and then he could have just went to work and came every night after work. But it wasn't like that at all. Many times he couldn't come even on weekends because he has to work. So sometimes it was 2 weeks at a time where I never saw my husband, and I was by myself there the whole time. I hope that people know how difficult it is when you have a situation like mine. It's devastating, and it would be nice to be home.
My name is Nathan Borowski. I'm the Clinical Operations Manager for the East Kootenay and Kootenay Boundary Renal Program. So currently in the East Kootenays, we have hemodialysis for all of our clients, as well as our chronic kidney disease clinic, both located here in Cranbrook. So we have this 4-chair unit at the East Kootenay Regional Hospital and the kidney care clinic located in the Rocky Mountain Lodge building. And then the other services through the East Kootenay is a small dialysis unit to provide the same hemodialysis in Creston and Sparwood, each with 4 chairs there. So the current hemodialysis services in Cranbrook, we offer 3 treatments per day, and we can have up to 4 clients in each of those spots. So the unit here operates 6 days a week, which allows 2 patient groups to kind of receive treatment through there. A typical dialysis treatment is 3 times a week for about 4 hours. When our clients get sick and require to be isolated, it does mean that they have to go to a higher care center, be that Trail or Kelowna, where we have isolation spaces, and those patients can be properly treated. To mitigate this, being able to have a bigger space with proper distancing between patients and full isolation area will be able to reduce the amount of times that our patients have to be sent and travel further from home.
My name is Krista, and I'm a registered nurse at the Cranbrook Dialysis Unit. Over the past 10 years, there's been an ebb and flow in the patient load, but overall a steady increase. To have a bigger space would benefit our clients specifically for their care to be connected with all the team members. Right now, the way it is set up is that half of our team members are across the parking lot or not even in the hospital where our unit is now. So to be under one roof would really connect their care. To have a new space for the staff would be beneficial as well in terms of having the connection with other team members. Hopefully we'll have our head nurse, maybe even our manager, our dietitian, our social work, as well as the nurses. So it's easier to connect on a level that we do every day instead of email and phone all the time. Another way that it would benefit us as nurses in here to have a bigger space would be our everyday care. Right now, we kind of work on top of each other. The patients are very close together. So for confidentiality, there isn't much room for private conversations around their care and their treatment, as well as assessments. With a bigger space, we'll have other rooms to do those things, including individual client care and clinics.
My name is Tracy, and I'm from Cranbrook, BC. I was diagnosed last October. It's called multiple myeloma. It's been quite the journey, actually. My kidneys have failed probably twice. And I've had to travel to Kelowna for radiation and surgeries. My most recent is lung collapsing. So I had to go to Kelowna for October. So I did 5 treatments. And I'm actually going back here pretty quickly when things are a little better to do some more radiation treatments. I'm just not sure of the dates here right away, but it's pretty quickly. And then I also have an upcoming chemo that can't be done here that also has to be done in Kelowna. So having to leave for treatments, you got to be away from your family. Well, it's not cheap to actually travel all the time. It's quite hard. It's always better to do it at your home or your hometown, obviously. And I know most recently by a couple of different doctors now that I've been recommended that I should actually move closer to a cancer clinic. And that means giving up my family. Yeah.
My name's Dr. Keith Loden, and I'm a GP in oncology, which is a family doctor with oncology training. And I've been working at the Cranbrook Clinic since 2002. Cancer care has really evolved in the East Kootenay since 2002. We've seen a lot of changes, not just in our unit, but in our patient population. The number of patients seems to be increasing exponentially, and the number of treatments for each patient is also increasing by quite a bit. So we're seeing the same patients more often, more frequently, and for longer periods. One of the big issues we face is that we serve patients from all over the East Kootenays. We have patients coming down from Golden, over from the Elk Valley, all the way to Elkford, Creston area, and of course Cranbrook, Kimberley, Invermere in the middle. And initially, our numbers were easy to treat. We had the chairs available and the staffing to look after the patients. But in recent years, we found that our chair time has become very restricted. We even have a wait list now, which we never used to have back in the original days of doing cancer in Cranbrook. And that's become quite a big problem for our unit. Planning ahead does need to address the issues of potentially having radiation therapy. It also has to address in a facility that we would be able to actually look after enough patients. Chair time has become longer with the additions of immune therapy and targeted therapy that we use now. And cancer isn't going away anytime soon. We're working on cures, but cancer is really a number of different diseases, and there won't be just one cure. We're going to need treatment in the East Kootenays for a long time to come, and we want to see care provided locally for our region.
My name is Jill. I'm the patient care coordinator in oncology, and I've been in this role for just over a month, and I've been working as a nurse in the unit for a year now.
My name is Maria. I've been working in East Kootenay Regional Hospital for 20 years and in oncology for 5.
We have 9 chairs in oncology, and we do treatments for the patients all day long. We usually have patients come in the morning and the afternoon, and we do systemic therapy here, and we'll do some injections as well.
I think having more private areas to provide care would enable so much more for our patients in oncology. Sometimes they're going through really hard times, and having more privacy in a new space would be life-changing for them.
So to have a one-stop shop for everybody can come and receive care, clericals here, physicians, would be ideal. And if we could get all of our patients' lab work done on the unit would be huge as well too, because these people are immune compromised and we're not able to accommodate patients to get labs done here because we're so busy on the unit. Even with the expansion of 2 more chairs, we could probably use another 2 more, and that's just in the next year. So having something, a bigger space, more privacy for patients, if they end up with a reaction, people are very vulnerable and they're in a room full of 8 other patients who are watching them go through this crisis and the families there watching, and it could be better. Please give what you can to help support these cancer patients through their journey.
They need you more than ever.
Please support the East Kootenay Foundation for Health and their drive for this project and donate what you can. It's really going to make a difference in patients' lives.
Please donate generously. It'll help a lot of families.
Cranbrook's supposed to be the hub of the Kootenays, so we should be able to do this, I hope.